Dr. Amanda Fisher. I am the owner and founder of Empower Your Pelvis. It's a pelvic floor clinic in Kansas City, Missouri. Today, we're going to talk about what to expect at your pelvic floor physical therapy appointment, your first appointment. Before we get started though, go ahead and subscribe to my channel. Share with a friend if you find this video valuable. When you go into your pelvic floor physical therapy appointment, before you arrive, they're probably having you fill out some paperwork online. That paperwork is going to ask you questions like, when was your first menstrual cycle? Have you had any children? Where are you having dysfunction? Are you having symptoms with coughing, leaking, sneezing? Are you having symptoms with jumping, running, lifting, carrying? Okay, we want to know exactly where you're having symptoms. There is no such thing as TMI. No such thing. If you're not giving us valuable information of when your symptoms are coming on, we can't give you all the puzzle pieces to put back together, okay? We're not getting the puzzle. We can't form it together. So we need to know all that lovely information. Nothing's TMI. Nothing needs to feel that you're embarrassed. That we are in this field, pelvic floor physical therapy, for a reason. We are musculoskeletal experts, being the physical therapy side. That's what we went to school for. And then we have specialized within pelvic floor. So pelvic floor are the muscles at the base of the pelvis. When you go in for your appointment, you're going to be brought back to a room similar to this one. We have a plinth where our patients lay down. After we go through their history, we are learning about them, but then we like to see them move, okay? Maybe before that, we're even educating your patients or educating you on the pelvic floor muscles, okay? So we'll go through that real quick and then we'll go through a simple exam. So these are the pelvic floor muscles. We've got another layer that sits up here. One of these muscles sits up like an upside down V. Another one runs across sits bone to sits bone, or your ischial tuberosities. And then one is a figure 8 muscle that loops around the vaginal opening and the anus. These muscles, 28 different of them, think about like 28 players on a football field, right? If somebody's not communicating or somebody's not playing the play that they're supposed to be playing, there's dysfunction. There's a ball that's been dropped. That's really what happens down here. We have such a huge bulk of muscles, 28. The pelvic floor is not one muscle. It is 28 different muscles working together as a team. Meaning we've got some type A personalities down here along with some type B personalities. It happens. Our job as pelvic floor PTs is to figure out where the dysfunction is, where our type B personalities are on vacation, maybe they need a little pick-me-up, and where our type A personalities need to let go because they're overworking. So how do we do that? Number one, we ask our patients to move. So I have my patients stand up, they bend over, touch their toes. I want to look at the range of motion in their spine. They will then stand and lean back. I want to see, again, what's happening back here. The nerves that supply that pelvic floor are back here, and I need to make sure that there's movement and mobility. We are going to side bend. Same thing. Do they have discomfort or pain as they lean side to side? And then sitting and rotating, are they having any dysfunction? If they're dealing with diastasis, I may give them weight and see what I'm seeing here as well. Then we will have them change from the waist down. They're going to cover up with a gown just below their waist so everything comes off, underwear, pants. Top stays on, because if I need to see their abdominal tissue for bowel work or a scar, cesarean scar, hysterectomy scars, I can do that just by lifting the shirt. I don't need them to be topless, okay? They're laying down here. I put gloves on my hand, and with one gloved finger, it's our magic finger, the pointer finger, I use that to assess the pelvic floor muscles, all right? Remember, 28 different muscles down here. I wanna know, how's the left side feeling? I'm gonna talk with my patient the whole time. You let me know if this is uncomfortable. And before we've done this exam, they have consented to the internal pelvic floor muscle examination. There ain't no speculum, there ain't any stirrups, so they're laying all the way back in this examination. So I'm assessing with one gloved hand. All right, on this right side, layer 1, how does it feel? Okay, this is what I'm feeling. Left side, how does it feel? Okay, and this is what I'm finding. I want to tell my patient what I'm finding, because these muscles are inside the pelvis. For them, it's like trying to move furniture in a dark room. They can't find it. So I'm allowing my touch, my tactile feedback with what I'm finding to allow them to connect with these muscles down here. I'll have them squeeze so that muscle tissue should tighten up. I want them to relax. I should feel it relax back down. The relaxation is actually harder than the contraction for most of our patients. I'm going to do a very similar examination at each level. There's 3 different levels. So we're going to go in layer 1, layer 2, layer 3 on both sides. I also want to see how long can they hold a squeeze? How many seconds? When does it start to fatigue out? At how many reps? Okay. I also want to know, what does it look like when they bear down? Can I feel any tissue moving? Can I see anything visually? I'll let the patient know what I'm finding. Then I'll come up abdominally, and I like to check abdominal tissue. In the 4 quadrants, we've got 2 lower, 2 upper. Are there restrictions? Are there restrictions around the bowels? Are there restrictions around the belly button, around the bladder? Okay, I'm assessing a lot of different things in the abdomen. And then, we're not living life laying on our back. Most of the time, our dysfunction is in different positions. Intercourse, this might be a position where we have discomfort and pain, or it might be in a different one as well. Sometimes we'll assess our patients not just laying on our back. We may put them on their belly in child's pose, sitting on the edge of the bed, moving from sit to stand. I want to see how things are moving. I want to give them weight if it's when they're lifting kids, lifting laundry, lifting bags, lifting weight at the gym, when they're having symptoms. And I want to see what's happening. Then we're going to go over the correct way to get that pelvic floor to engage for that patient, or to disengage, to relax, so that we can promote good function of that pelvic floor. Remember, these muscles, 28 different muscles down here, need to contract, but they need to also relax, just like any other muscles in our body. And we need to make sure that these guys are learning to do so, okay? So that is the quick and dirty of what happens with an internal or during your pelvic floor muscle examination. If you have any questions, please leave them below. If you haven't yet, please subscribe to this channel, and I'm more than happy to help you any way I can. Thank you so much, guys.